Hi, my name is Dr. David, neurosurgeon specialized in pain management. Today's topic is distal radius fracture. Distal radius fracture is the most common orthopaedic injury and generally results from fall on an outstretched hand. Diagnosis is made clinically an X-ray of the wrist. It accounts for about 17.5% of all fractures in adults. There are many kinds of distal radius fracture. Colles fracture and Smith fracture is the most common and popular type of fracture. Colles fracture is low energy, dorsally displaced, extra-articular fracture. On the other hand, Smith fracture is low energy, volarly displaced, extra-articular fracture. Also, there are many types of fracture, such as thigh punch fracture, barton's fracture, or shepherd's fracture. In this video, I will not make focus on these fractures. Associated conditions include distal radius ulnar joint injury, which is articulation between the ulnar head and the sigmoid notch. Also, radius hyaloid fracture, TFCC injury, scapholunate ligament injury, etc. Remembering this possibility is imperative because it is important to examine every possible conditions. A 60-year-old woman was injured her radius while falling. She was diagnosed with a fracture of a distal radius fracture after visiting my clinic. The fracture was in the stable condition, so conservative treatment method was chosen. After 4 weeks of plaster cast immobilization, she was prescribed physical therapy. Specifically, the X-ray showed a Lister fracture, so she was advised to be careful of the fracture site and to perform range of motion exercise. During the plaster cast immobilization, she received guidance of exercises for the wrist and was able to maintain good mobility. When I perform wrist extension exercise to the patient, I felt the feeling of clicking in the Lister's tuberosity area. When I extend the thumb, the feeling became bigger. From this, when I relaxed the extensor pollicis longus muscle, as shown in this picture, and performed the extension exercise in a relaxed state, I was able to do the extension exercise without any comfort. After 4 weeks, the bone healing was enough and the discomfort in Lister's tuberosity also disappeared and the range of motion of wrist extension improved. However, when touched with hands, there was pain on the dorsal side of the wrist and the range of motion when wrist flexion was limited. When I evaluated the part that was tightened, I confirmed pain on radial side of the wrist. Therefore, by performing reverse dart throwing exercise on the part, the range of motion limitation of the wrist improved and cured. I will tell you on the last part of the video about darting exercise and reverse dart exercise. There's a report that the incidence of extensor pollicis longus muscle rupture is below 1% in radius fracture patient. And also there's a study that looked at 9 cases of Lister's tuberosity fracture. The average time it took for the fracture to tendon rupture was 21 days. The study also notes that the causes of the fractures include mechanical friction caused by displaced bone fragments, partial occlusion of blood flow and blood clots, in addition to other factors such as poor blood circulation and malnutrition. It also mentioned that when patients perform exercises that move the bone in the direction of the fracture, they will experience pain and crepitation. It is important to be aware of the tear and take precautions. Lister's tuberosity fracture is a protruding bone spur is a fracture of protruding bone spur on slightly lateral side of the central part of radius end. The extensor pollicis longus muscle runs just next to it. In radius fracture, the risk of extensor pollicis longus tendon tear is increased in cases where the fracture line is located in Lister's tuberosity with less dislocation. In my case, it appears that the patient has a Lister's tuberosity fracture and the extensor pollicis longus tendon rupture that runs next to this area. In cases of radius fracture, when the displacement is minimal, there is a higher risk of extensor pollicis longus tendon rupture. In this kind of cases, it is suggested that the patient should be cautious of the risk of extensor pollicis longus tendon rupture while working to regain the range of motion of the wrist joint. It is important to maintain the flexibility of the extensor pollicis longus tendon while manually correcting the wrist joint to ensure safe range of motion of the wrist joint. In cases where there is a possibility of extensor pollicis longus muscle tendon tear, it is important to improve the flexibility of the muscle during the pre-treatment process. Improving the flexibility of the extensor pollicis longus tendon can be done by slightly push the thumb towards the radial side and maintain the position where the metacarpal-phalangeal joint is flexed and the intercarpal joint is extended. When performing wrist flexion exercise, it is important to maintain this position not to harm extensor pollicis longus tendon. Dart throwing exercise is a single joint exercise for the wrist joint alone and has been used to expand the range of motion while avoiding the compressive stress on the bone when it's not fully consolidated. The opposite movement, which connects the ulnar palmar and radial dorsal movement, is called the reverse dart throwing exercise. Repeating this exercise might help you keep your range of motion in wrist problems. Well, thank you for listening to my video, and if you felt this video is so informative, please subscribe my channel and watch my next video. Thank you very much.